Because people don't want to hear my opinion on all that.
John Bozica, 1480 WHBC. Final two segments of the morning from OMNI Orthopaedics as we continue our discussion when it comes to different, parts of orthopedic surgery, different things that are happening in the field, different things that are allowing us to progress in the field. And we bring in our final guest of the day, and that is Dr. Ira Richterman, who is the CEO and board-certified orthopedic surgeon specializing in hand and wrist surgery. Dr. Richterman, thanks for joining me.
Thanks for having us. Really appreciate you guys coming out here to OMNI and having some good discussions. Hopefully my partners and my colleagues and administrators have shared a lot of good things here about OMNI and have enlightened you about the services that we provide for our community here.
Yeah, they have. I mean, it's kind of opened my eyes to how things have changed over the course of time and how we continue to adapt and evolve to different parts of medicine, and I guess we'll start with what it is that you specialize in, and that's hand and wrist. And I'll ask the question that I've asked a lot of people this morning, which is, how has hand and wrist surgery changed over time, or has it really changed over time?
No, I think it's a great question. A lot of times patients and people out in the community, they see what's on TV, they read the newspapers, they see the advertisements. And I think most importantly, when you talk about advancements and the latest and changes, I think it's really important for patients to ask their physicians. And I would encourage patients when they see an advertisement about the latest and greatest, and you have to really kind of educate and say, is what they're reading truly the latest and greatest, or is it marketing? I think in the issue of hand surgery in particular, there's been a few changes within our industry, but the majority of our changes, believe it or not, is not in the actual technical care. For example, whether it's carpal tunnel surgery or fixing trauma and fractures, some of our equipment has changed a little bit, and the goal with all of orthopedics is really how quickly can we restore function and provide pain relief. That's the key in however you approach, whether it's my partners doing hip replacements or myself reconstructing a bad hand injury. And I think what probably the most important thing is for everybody to understand it's not Ira Richterman fixing your hand. It's Richterman's team, and my team is really comprised of a lot of members. A single quarterback can't go out on a football field and call the offense if he doesn't have another 10 people around him that make him or her very, very successful. And I think every practice out there in medicine is the same. And for myself in the hand surgical world, our surgical team at our surgery center, and most importantly, I have three of the most wonderful hand therapists that work with us. And without Terry, Lisa, and Jen, I always tease the three of them. I'm so glad that they are younger than I am, because I'm going to retire before they will. And but it's hand therapy is really, really pivotal to the outcome of the success of hand surgery. And if you're dealing with a traumatic hand injury, let's say you cut a tendon in your hand, people don't understand that's a 12-week recovery. It takes a long time, with often potentially other things that need to be done down the road. And I think it's important that the patients really kind of buy into that concept that it is a team approach. Yeah, Richterman is one component of the team, but the secretaries who are scheduling timely appointments, all the way to unfortunately, healthcare is not cheap, and we have to help people work through the insurances, which I don't even understand my own healthcare insurance. It's so confusing that I rely on my staff to
join the
tell
club.
me. Yeah, it's very difficult. It's very, very difficult. In the true technical world of hand surgery, I think you see a very large trend throughout the country where, in orthopedics in particular, there is a big drive towards outpatient surgery. And outpatient surgery, whether it's done in a private setting like Oasis, our surgical center, or it's done as an outpatient setting at the hospital, I think patients are understanding now that recovery starts the minute you open your eyes. And if that recovery can be done at home in the comfort of your home and can be done as an outpatient, I think that's really the success. But the patients have to take ownership in their recovery. If I do a complex hand reconstruction and you don't buy into the concept that it requires you to do several months of work with the therapist and it requires you to do work on your own, it's the old adage, I can bring that horse to water, but I can't make them drink. And so I think with advances of orthopedics, I think the real concept is this team approach. And making patients aware and understanding that they are part of the team. It's not just the team helping them. And if I include you as part of our team and make you part of your recovery and ask you to take ownership of your outcome, I think that's really the key in healthcare, whether it's a total joint replacement or, like I said, a hand reconstruction.
So if you're the Carson Wentz, I could take it then?
Yes, thank you very much. I appreciate that. I am a large Eagles fan.
I was listening through the break there. Even though you have the Browns mug, I was listening to that. So if you're the Carson Wentz, it's key to have a lot of good targets around you, I guess, to get the ball to. But when it comes to having that therapy and having those things that allow you to get back on your feet, allow you to use your hand again, use your wrist again, what's changed so much there where it has become a quicker process from, let's say, 20 years ago? And
it's a great question. If we go back to when I started my practice, I came to OMNI Orthopaedics in 1997. And I give you an example with wrist fractures. If you had a really, really bad wrist fracture at that time, the treatment involved a type of fixation where the wrist was immobilized for 8 weeks before we even started you moving. There was a hand surgeon in Florida that developed a revolutionary concept within the hardware that began about 10 years ago. And in orthopedics, it's the way the screws and the plates kind of work mechanically, and it allows us to move patients very, very quickly for fractures that are close to the joints. So we went from a time period when I started in 1997 where we used to put what's called an external fixator, John, which has some pins and things on the outside. It makes you look like the Terminator a little bit. But we wouldn't allow people to move their wrists for almost 8 weeks. Let's fast forward to today. If you have a wrist fracture that's fixed today, typically you're never put in a cast. 10 days later, you're in a removable splint, and you start with that therapist right away. So by the time that patient now gets to week 6 or week 8, they've restored back to functional range of motion. And sometimes I have patients that come back in week 8. They say to me, and as I'm discharging them from the practice because they did well, they say to me, "Oh my gosh, this took such a long time." And then I have to give them the history of hand surgery, where if we just went back 15 years ago, at week 8, they would just be starting the process. And so I think what's happened, and if you look at the research has really shown to us the ability to move people a lot quicker, mobilize them a lot quicker, and that's clearly the trend as we're going. Much less narcotic usage that we've used in the past, especially for the bigger procedures. And I think there's just a definite drive to get people moving quicker, and I think that's the key. As far as the industry in and of itself, I think some hardware has changed. We use some products, different bone graft products now that are changed. That when we have some tough fractures that are difficult to heal, but I think most importantly, we have a society that's getting a little bit more concerned about their health. We're hopefully seeing a nice decline in smoking, which is really a big issue, for us. People are choosing a little bit more of a healthier lifestyle. They're at least paying attention to try to go in that direction. It clearly makes it a lot better for the orthopedic surgeons and their outcome when you're treating people that are taking care of themselves. It's very hard to take care of people who don't want to take care of themselves. And so I think that's a nice society change that we're seeing as well. I think orthopedics is an evolutionary process. I mean, I think that the day that the young physician graduates and they're typically about 32 years old, I think that's the time that beginning is really starting to learn. You're not learning all through medical school and residency and say, when I'm done my training, it's over. No. Training, I think, is really just beginning, because now you're learning how to really deal with the patients, run a practice, help people in all different aspects of their recovery. But most importantly, you have to continuously evolve your practice. Don't be afraid to learn, and don't be afraid to keep your eyes and ears open. I think the physicians that kind of give up on that education a little bit are just selling themselves, but most importantly, they're selling their patients and their community short. I see the guys in our group here, whether we're sitting around at lunchtime, and sometimes people would look at us and not believe the fact that we're discussing some hardcore orthopedic stuff, or the guys are always presenting cases to their partners and just asking, hey, what would you do in this situation? I have a group of my friends that we're in a big WhatsApp group, and where I have hand surgeons all over the country, and if any of us has a tough case, we're always throwing an x-ray up or describing a situation and saying, hey, have you guys seen this before? What is anybody's experience? And I think if you don't have an open eye and approach it that way, you're never going to get better, and you're never going to learn. So I challenge all the orthopedic surgeons and my colleagues out there, don't stop learning.
I think you might have to give Sarah, who's here taking photos for some reconstructive surgery, as she dropped her phone. There might be something wrong with her hand.
Yeah. I thought she was upset with me at first and was throwing the phone at me.
I think the grip of her hand might be some tendon issues in there. I'm not sure.
We could check that out. That's not a problem.
We'll take a break here with Dr. Ira Richterman, CEO, board-certified orthopedic surgeon specializing in hand and wrist surgery. When we come back, we're going to talk about how OMNI continues to progress towards the future of orthopedic medicine and what we need to know moving forward with OMNI Orthopaedics. That when we come back.